All right, now we're continuing forward. So now I have everything organized and set up. So now I'm ready for my surgeon to come in. So as they're coming into the room, I'm going to go ahead and prepare their towel. So I'm going to just unfold it lengthwise and then fold it in half, okay? And then I'm going to drape it over their hand, still maintaining my distance. As I'm doing this, I'm going to go ahead and grab their gown, and I'm going to begin to introduce myself. So hi, I'm Elliot Wagner. I'm a surgical technology student at Southeast Community College. And then from here, where I'm going to begin gowning them. So now the book is going to open up towards me this time. So you can see here, okay, so the book's going to open up towards me. I'm going to grab the Velcro or the neck of their gown as they open up towards me and just let it fall. Okay, so now they should see their sleeves, or begin to see their sleeves. So now I'm going to go ahead and protect my hands and then expose their sleeves. Okay, so I'm going to extend up above their elbows and begin to expose their hands. As I'm doing this, you notice the circulator is tying them in the back as an unsterile roll. Okay? So now I'm going to go ahead and begin gloving them. Okay, so to do this, so fingers down, thumbs pointing towards the surgeon, and then I'm going to begin doing my cowboy hat. So I have my thumbs in the inside of the glove, fingers or pinkies towards me, pointer finger or middle finger towards him, and then thumbs to the side, so to create my nice cowboy hat. I'm going to do the same thing on the other side, so thumb toward them, fingers down. I'm going to ask them if they would like to spin. So he's going to hand the card to me. As they're spinning, I'm removing the card from the tie and handing it to them. Okay?
Okay. Can you take that malleable and put it on the mail stand, please?
So now we're going to demonstrate going back to back. So spinning with somebody sterile, I'm always turning my back towards them. We're either crossing face to face or back to back. Okay?
Okay, bring it back. I don't need it.
Okay.
That's good.
Okay, so I'm going to go ahead and turn my back, keeping the instrument at a sterile level. And once I get to here, I'm going to face now my sterile field.
Okay. Why don't you go to lunch?
Okay? So now I'm going to go ahead and go to lunch. So now I'm going to break out. So to do this, I'm going to go ahead and untie my front tie here. Okay? And then I'm going to go ahead and grab at my sides. I can kind of feel the tie in my back. I'm going to arch my back like a mad cat, pull down, and then away from myself. Okay? So now I'm going to begin rolling it inside out, keeping all the contents inside, and throwing it in the trash. Now I'm going to go ahead and remove glove to glove and skin to skin, and then do hand hygiene. So I'm just going to come over to the corner and do hand sanitizer. Okay. Okay. Now I'm coming back from break. I'm back from break. Can I get you anything, Surgeon?
Yeah, I would take some saline, please.
Yeah. All right. So now I'm going to demonstrate pouring fluids. So when I'm pouring fluids, the first thing I'm going to do is I'm going to read the entire drug name. So here I have 0.9% sodium chloride. It expires 9/16 of 2027, and I have 500 milliliters.
Okay.
So when I'm pouring this, it's the same concept, so I'm maintaining 12 to 18 inches above the receptacle. Okay.
So I've got all kinds of yuck on me, and I need to break out of this because it's all contaminated.
Peel out? You want to
Yep.
peel out? Okay.
Yep.
Okay. So now he wants to peel out, so that means he wants to preserve it. Okay, now I'm going to place my exam gloves to go ahead and peel him out. So he wants to preserve his scrub, like I said. So the first thing I'm going to do is I'm going to have him step away from the sterile field. Okay, and then I'm going to go ahead and ask him to go ahead and untie the front tie there. As he does this, as an unsterile person, I'm going to come to the back of the gown. Okay, and I'm going to unvelcro it here, untie it in the back, and then I'm going to begin to encourage it over his shoulders. Okay, now I'm going to come to his front. We can kind of turn towards them so they can kind of see here. So I'm going to grab the gown, corners here off of his shoulders. I'm going to peel it inside out so I'm preserving his scrub. Okay, I'm going to go ahead and throw that in the trash. And now from here, I'm going to use the hook method. So I'm just coming in, hooking the glove, and removing it without touching their skin. Again, I'm preserving their scrub. Okay. After I do this, I'm gonna go ahead and remove my gloves, glove to glove, skin to skin, and then I'm gonna come over here and do hand hygiene again. Again, anytime we remove our gloves, we wanna do hand hygiene, okay? And then the last thing one of the last things I'm gonna do is make sure that they have another gown and gloves on the field. If they don't, then I'm responsible for opening it up for them. So it looks like he does, so certain you do have a gown and gloves, don't. And then I'm gonna go ahead and basically verify who would gown and glove him. Okay, so we can't gown and glove off of a back table, so we're always going to have a sterile member gown and glove them for them. So I'm just going to say, somebody in the sterile role will gown and glove you. Okay, and then the last thing we're going to do is demonstrate just how to tie the back of a gown as an unsterile person. So to do this, I'm going to go ahead and we're just going to reuse the gown that we had prior. And he's just going to throw this on, and then we're just going to demonstrate how to tie the back of a gown. So I'm coming in, grabbing from the inside, velcroing his neck first, and then coming underneath and grabbing the inside tie on both sides, and then just tying a knot. Okay, that's your competency assessment 1.